Hello everyone, Drew Watts with Restorative Oxygen Care, here with our medical director, Dr. James Collier.
Hello.
And today, this is another video in our series discussing cancer treatments and how hyperbaric oxygen therapy can help with some of those cancer treatments. In another video that we've done talking about pelvic radiation, this is another one that kind of falls into line there with the pelvic radiation, and that is something called radiation cystitis.
Right.
So explain to anybody watching what is radiation cystitis.
Okay. So cystitis is an inflammation of the lining of the bladder. It can often be caused by infection, sometimes by other chemicals. But when someone has radiation involving the bladder area, particularly in the bladder or in the prostate, and is treated with radiation, the radiation itself will cause cystitis. That varies widely from person to person. The radiation oncologists are getting better and better at avoiding this in the first place, but some people are left with a very irritable, inflamed bladder that can be difficult to control. So these are signs of radiation cystitis. If you have had radiation in the pelvic area, particularly if it involved the bladder or the prostate, this might be a case where we can help you very much. It's one of the most rewarding treatments that we do because it is so responsive to the hyperbaric oxygen therapy. The hyperbaric delivers high volumes of oxygen and helps to recreate the tissue of the lining of the bladder to make the cystitis resolve. So if you have had radiation to the bladder area and are having persistent difficulty with your bladder or urinary function, you might want to talk to your providers and see if a consultation with hyperbarics could be helpful to you, because we are highly successful in suppressing this problem.
Okay, so when should a potential patient think about this? When should they talk to their doctor?
Right. So if you are having a chronically irritable bladder, you have to go too much, your urine looks funny, especially if it has blood in it, or just simply hurts, and you have had a previous exposure to radiation, you may have a chronic radiation cystitis. Hyperbaric oxygen is very effective in resolving this problem. So you need to discuss any suspicion of this problem with any of your physician providers to consider whether a referral for a hyperbaric oxygen evaluation would be helpful.
All right, thank you so much, Dr. Collier. If you have any questions or think that hyperbaric oxygen therapy may be appropriate for some of these symptoms related to radiation cystitis, the information is at the bottom of the screen. You can give us a call, or you can reach out on our website, and somebody from our office medical staff will be happy to answer any questions you may have and help coordinate care, if necessary, with your referring provider.